Attorneys for George Huguely are disputing claims he shook Cockeysville native Yardley Love so hard that her head hit a wall. A Virginia grand jury will next hear the evidence in this case on Monday. It is expected it will also hear Huguely's attorneys offer other suggestions as to how the UVA lacrosse player died. The coroner ruled the cause of death as blunt force trauma, but the defense says there is no evidence of that, no blood or indentations to be found. Instead, Huguely's attorneys are suggesting two things. Either he was too drunk to understand what he did or said to police, or that Yardley Love died of a heart condition allegedly brought on by her use of the ADD medication Adderall and also alcohol.
And while we're on that subject, many ask, how valid is that argument? It certainly raises great concern for millions of students who take ADD medications.
Especially those in college who, let's be honest here, of course, most likely do drink alcohol as well. Tonight, I talked with one local psychiatrist who specializes in the treatment of ADD and ADHD, and I wanted to know, are these kids at risk?
I think what we're finding nowadays.
Dr. Arman Taghizadeh wants to make it clear. His conversation with me is no reflection on the case against George Huguely or the medical suggestions directed toward Yardley Love. But he was willing to clarify some confusion, some suggestions that have been coming out of that Virginia courtroom. Millions of young people and adults take ADD medications. They come under a laundry list of names: Concerta, Ritalin, Focalin. And there's a second class of drugs that are amphetamine-based. That includes Vyvanse and Adderall, the drug reportedly found in Love's body. Based on the assertions made by the Huguely defense, we were wondering, how dangerous are these drugs to the millions who take them?
As to whether these medications cause heart attacks or cause cardiac defects, I think that's more of a myth.
Dr. Taghizadeh says that's because a patient's full medical history is screened and evaluated prior to prescription. If there are any flags, an EKG is ordered or a cardiologist is consulted. What about some other concerns raised? If there is an athlete who is on ADD medication, are they at a greater risk for a heart attack or a heart condition related to the medication?
I'm not aware of any increased risk. We have a lot of student athletes that we treat who have true ADHD, and they tolerate their stimulants well.
He says that, in general, the hearts of athletes are in much better shape. They have a lower resting blood pressure, and their risk of cardiac condition is much lower than non-athletes. If there is an athlete student who is on ADD medication and then there's alcohol consumed within that scope, could that be a concern for a heart condition as well?
In general, if these medications are taken as prescribed, there's usually a point at which they do wear off. The shorter acting medications tend to wear off after about 4 to 6 hours. The longer acting medications after about 8 to 12 hours. Generally, these are given during the morning, during the school academic time. That being said, they should be worn out of the system by the evening time, which is in general when most of the alcohol is consumed.
And he goes on to say that even if there are trace amounts of both the drug and the alcohol, it is not at a level that should cause any sort of problem. And also tonight on another subject, we're looking at a